Hello future doctors. In this video, you will learn how to approach anatomy as a first year MBBS student. So the first thing is, what is anatomy? So anatomy is the study of structure of a human body, and it is the foundation of all medical knowledge that helping you understand how everything is organized and connected. Basically, anatomy is divided into three parts: gross anatomy, histology, and embryology. The first one, gross anatomy, is a study of body structures you can see with the naked eyes, like upper limb, lower limb, abdomen, head and neck. And the second thing is histology. Histology is a microscopic study of tissue and cells. And third one is embryology, is the development of body structures from conception to birth. So how to study gross anatomy? So start every topic with an atlas to visualize, and please don't skip dissection hall sessions, because that is the place where you learn actually. And you can use this method, which is see, read and draw. In dissection hall you will see the structures, body parts and all about. Try to read from book and then try diagrams, because anatomy is all about diagrams. How to study histology? So use color coded diagrams and repetitions, and relate tissues to their function and physiology, and watch microscopic slides and videos for better understanding. Understand developmental stages with flowcharts, and use simple sketches to remember weekly growth changes. Best books for anatomy. The first is Grey's Anatomy for students for clear concepts, but it is very lengthy. Second is Chaurasia for regional anatomy, and it is better for clinical aspects and theory. And third one is Vishram Singh for simple and easy to read language and for best diagrams. To revise anatomy, make short notes and mnemonics. Revise regularly using diagrams and flashcards. Discuss topics with friends for better retention. So the final tip is, be consistent, visualize everything and stay curious. If you found this helpful, please like, share and subscribe. Keep learning and exploring anatomy. All the best for your first year MBBS. Thank you.